situation that I want to bring people's attention to, because there seems to be a lot of misinformation circulating about this, including even amongst healthcare workers. And that is, if you have symptoms of COVID, which is basically a cold or a flu-like symptoms, right? Sore throat, cough, a little bit of runny nose maybe, loss of sense of taste or smell, and fever, and any combination of those, and you should be tested still for COVID. And that includes if you've been vaccinated. So certainly if you've been unvaccinated, you should get tested, but you should still get tested if you've been vaccinated, because we do have a small number of breakthrough infections. And in those situations, it's possible you can spread COVID to other people. So you need to get tested. So the situation I've been made aware of is people coming to urgent care settings with signs and symptoms of colds, and they've been told that they don't need to get tested because they've been vaccinated. That's wrong. If you have signs and symptoms of COVID, even if vaccinated, you need to get tested. So make sure you go, get tested, and that way you can be reassured if it's negative, or protect your people around you if you're positive. If somebody tells you differently, tell them Dr. Ohl said, I'm symptomatic, I've been vaccinated, I need to be tested. It looks like the Delta variant has a relative risk of hospitalization for COVID. If you get it, that's 1.8. So basically that means you're almost twice as likely to get hospitalized if you get the Delta variant than if you get the Alpha variant. And that's across all comers. Now that risk goes up even more for people who have underlying diseases, diabetes, kidney disease, heart disease, lung disease, so on and so forth, obesity, but even in people who have no other health problems, the risk of hospitalization goes up. And then the other thing we found is that transmissibility is about, well, they say 60% more, which is about 1.5 times as much as the normal virus. It's not huge, but it's substantial much. However, if you've only got one dose of either of those vaccines, and both are a 2-dose series, you get your chances of your protection efficacy percentage goes down to about 33%. So it looks like for the Delta variant, one dose is not going to be enough. I mean, I don't want to be really pessimistic about all of this, but Scotland's vaccination rates overall are about the same as they are here in the United States. Right now, the Delta variant in the United States is about 10% of what our variants are. 10% of all of our strains here in the U.S. is the Delta variant. By the end of July, it'll likely be around 85 to 90%, because the transmissibility gives this virus more of a foothold to get into the population. This is occurring at roughly the same time as the country has decided that COVID is over and that we don't need to do anything anymore. And so all of those other mitigation things that we know work, like masks, social distancing, avoiding crowds, avoiding situations where transmission can occur, have largely gone away, which means that this Delta variant is going to take advantage of that. And it's particularly going to take advantage of that in the unvaccinated population, or the population of people who've only gotten one dose of the 2-dose vaccines. So if you've gotten one dose of the 2-dose vaccines and you kind of didn't like how you felt afterwards and you thought you'd just write it out because one dose might be enough, go get your second dose. And you can get it now. Even if you got dose number 1 in the beginning of January, you can get dose number 2 now. Spacing it out like that actually doesn't reduce the effectiveness of the vaccine. So go get it now, boost your immunity, get protected for this Delta variant. because I really, really would hate to see people getting hospitalized who've gotten one dose of vaccine when the Delta variant comes around, which it's going to. So it's going to affect mostly the unvaccinated population, and then secondarily the